At this big celebration yesterday, a big anniversary for Church Health. What are we talking about? 37 years?
38 years.
38 years now.
Yes.
Yeah.
We are generational in Memphis, so we're happy to be here serving the community and making sure that everybody has got a place to go, access to health care.
Yeah, a big day for 901, big day to celebrate that for sure. I was reading an interesting quote about you, and you said, "I am not a doctor or a minister, and I don't pretend to be. I'm a champion for this cause, and as for the philosophy of looking out for this community, that has not changed." What do those words mean to you?
Well, so our founder, Dr. Scott Morris, came to Memphis wanting to make this place a better community and engaging the faith community to help us serve those in need and help us just serve our neighbors. And that's what we've been doing for 38 years. And it is something that's important to me, to my family. And so we're going to keep doing that here at Church Health.
When it comes to the strategy and your vision, what do you see there going forward, especially with our needs for so many underserved families and individuals who call Memphis home?
Yeah, so there is a lot of need in Memphis, but there are a lot of people who want to do good. And so we just have to work with our community partners to make sure that we are engaging the faith community as well as the volunteers, providers, just everybody who wants to make Memphis a better place. And so I go about this a little bit differently than Scott because I'm not in the exam room. But, I'm able to help tell his stories and share his vision and passion. We've got a great team who is working at the organization. We're about 225 employees who just, want to be there to serve others. And so we're going to keep doing that.
When it comes to those wanting to be right there, some of those great healthcare specialists in so many different roles there, Jenny, what do you see? How does that play out? And how do you make those folks, they seem like they want to be a part of the team, are they not?
Well, I think everybody wants to do good in this world, whether they are expanding their own career or just wanting to do more. People are going to want to serve to help others. And the volunteer providers, so we have 20 providers on staff that are seeing our patients in our primary care settings. But then, of course, everybody needs access to additional subspecialty. And we found the retired physicians are a great asset. We've essentially built them a playground at Crosstown Concourse to help make our work possible.
I like the way you put that.
Well, those are Scott's words, not mine, but they sure fit. So we just, people want a place to go and a place to do good, and we're going to provide them that.
Help paint this picture, though, for us, Jenny. When it comes to, again, the need, the wait list out there, what are we seeing there?
The need is growing. With all of the changes with the Affordable Care Act and the marketplace plans, the big beautiful bill, cuts to TennCare, Tennessee Breast and Cervical, we know that the need is growing and the line at our door is going to continue. For new patient appointments, we are on a wait list, probably 2 to 3 months, depending on what the need is. But if you are sick or hurt today, you can come into our walk-in clinic as long as you don't have insurance. We're going to take care of you.
With those changes, though, how do you continue to adapt, though, to healthcare changes? Because it seems like there is something new on the table almost every day.
There is. And we just have to keep our heads level. For 38 years, Church Health has filled the gap, and there have been folks who have come long before me and long after me who know that that is what we have to do. There's always going to be a need, and our community partners, the partnerships, the hospitals, the labs, the diagnostic centers, other primary care clinics, we all want to take care of the folks. And so we're just going to figure out how it happens.
When it comes to taking care of those folks, what has been one of the most rewarding things for you? I mean, I know there's so much personal interaction with people who come through Church Health. What's that like for you, and what are some of the stories that you've heard?
So, a couple. It's fun to be out places with the Church Health logo or name tag on, and someone says, y'all saved my life. Well, I probably didn't, but there's always a story behind there, whether it was someone who didn't know where to go, they didn't want to go to the emergency department, so they found us, and we took care of a problem. But probably every day I can pass by the folks at the Welcome Center who are working our volunteer shifts, and they're checking our patients in and guiding them to where they need to go. And to watch them walk in a little intimidated, fearful, scared, not knowing what the doctor is going to say, but then they leave with a sense of hope and relief, and you can almost see the weights lifted off of their shoulders.
That says a lot for sure. I know over the years your focus has been on finances, but now you're shifting gears here. How do you balance those two?
So, I mentioned I have a great team. So I have between our board and my chief executive, or my chief financial officer and my other chiefs, we have a great partnership and team. So they help ground me to make sure that I'm staying in my own lanes. But we're working on our strategic plan now. And so we're really focusing on patient engagement, patient access, adjusting some processes so we can make things flow a little bit smoother, volunteer engagement, community engagement, and then of course the financial stability. So if we can keep all four of those things in balance, we're going to do just fine.
I think with your leadership, it will continue to happen for sure.
Well, I think so. But it takes the community, it takes the partnerships, and the calls to action are real.
You have a great village for sure.
We do.
Jenny,
Thank
glad to have you here. Let's continue this conversation.
Happy to.
All right, glad to have you back
Okay.
in the future.
Thank
All right,
you.
a short break. We'll be right back in a moment.